Come on in.
morning.
Hi.
My name is Lori. I'll be your nurse today.
Oh, okay.
Can you tell me your name and birth date?
Luann Lonergan, 45 blah blah blah.
Okay, good, Luann. The doctor wants us to check your blood sugar today, so that's what we're going to do.
Oh,
First, I'm
okay.
going to wash my hands. And I already grabbed a paper towel. I'm going to put all of my supplies, which is the meter, and I have a 2x2, and I have the strip to go in the meter. I have some alcohol swabs, and I have my lancet. I'm going to grab my gloves. So I'm going to just put my gloves on here. And I'm going to put my strip in. The strip actually has a side that has some coloring to it, and the back side is actually all one color. The side that has the coloring actually is how you put the strip in. If you put the strip in, it will automatically turn on. Then there'll be like a little drop of blood that's ready. Then the meter is ready. Okay, I'm going to come then, I'm going to have Luann. Does it matter which hand we use, Luann?
No,
okay,
no.
You can use the right or the left hand. And generally you stay on the sides, never on the pad of the finger, always off to the sides. And it looks like your fingers haven't been poked too often, so I'm going to just choose this finger if that's okay.
Sure, sure.
Some institutions use just water, some institutions use soap and water. We're going to just use alcohol, and I'm going to just wipe that off a little bit. We're going to allow that to dry.
Okay.
And this is the lancet that we're going to use. There's a cover on there. We're going to pull that off. And the needle is actually inside of there. When we push this whole lancet down, that blue part goes up into the yellow part and actually pokes her finger. So it looks like it's dry. So we're going to hold it perpendicular to her finger, and on the count of 3, you're going to feel a little poke. 1, 2, 3. Okay, I'm going to set that in. She's got a little bit of blood there. We're going to wipe the first drop of blood away. And then I'm going to actually kind of milk her finger so she gets a drop of blood there. And we're going to bring the machine here, and we're going to actually set it next to it. It kind of wicks it up, and within 5 seconds it reads out, and it's 125. She's got a little bit of blood here. I'm going to hold that down. And typically we want your blood sugar between 70 and 99 if you've
Okay.
been fasting.
Oh, I just ate lunch.
Oh, okay. All right. So we'll make sure that we note that on the chart.
Okay.
Okay, some other things that we could do, and that looks like that stopped bleeding, and she actually bled pretty good for us. But I'm going to just demonstrate on this hand. If somebody would be poked several times, we could do what's called milking to just, you can see how red the finger gets. We also could put a warm washcloth on her hand to help the blood supply come down to her finger. We could also lower it down to get more blood supply down to that finger as well. Those are all different techniques you can use in order to get more blood down to the finger before you actually even poke them. Now that we have our blood sugar is completed, we need to take out the strip. And typically there are wipes within an institution that we have to wipe, and my wipes are over here. We would take out a wipe, and we would wipe off our meter. And depending on which facility you're at, they may even have you wipe your meter and leave it on for 3 minutes. Again, some facilities just have you wipe and throw it away. Some actually leave it on for 3 minutes in order to disinfect your meter. And then we would make sure that we go document Luann's blood sugar. The lancet we have to put in the sharps container, so we would come over and actually put that in the sharps container.